The most important contribution that the abdominal wall muscles make in the movements of respiration is in the powerful action of forced expiration, as in coughing or sneezing. In addition to the muscles of respiration that we've seen, there are some minor ones that we're going to leave out since they're unimportant. These are the levators of the ribs and the serratus posterior muscles on the outside, and the transversus thoracis and innermost intercostal muscles on the inside. In addition to being an expandable container for the heart and lungs, the thorax also forms the foundation from which the upper extremity arises. The muscles of the shoulder region, which cover up most of the ribs in front and all the ribs behind, are shown in volume 1 of this atlas. Now, we're nearly ready to move on to look at the blood vessels and nerves of the thorax. Before we do that, let's review what we've seen of the muscles of respiration. Here's the parietal pleura and the visceral pleura. Here's the pleural cavity and the mediastinum. Here's the dome of the pleura. Here's the diaphragm. The right and left crus, the vena cava foramen, the esophageal hiatus, the aortic opening. Here are the external intercostal muscles, the scalene muscles, anterior, middle, and posterior, the internal intercostals. Lastly, here are the rectus abdominis, transversus abdominis, internal oblique, and external oblique muscles. Now that we've seen the bones and muscles of the thorax, we'll look at the principal blood vessels and nerves of the thoracic region. Of the blood vessels that we'll look at, there are some that we'll see only in passing, the pulmonary vessels. These are the major vessels which pass between the heart and the lungs. We'll see these more fully in volume 5. We'll start with the arteries, and we'll begin by looking at the largest artery in the body, the aorta. Here's the left pleural cavity, with the lung removed and the heart and mediastinum undisturbed. Here's the aorta, partly hidden beneath the pleura. It emerges from the left ventricle of the heart, arches over, and runs down alongside the vertebral bodies. It leaves the thorax by passing through the diaphragm and into the abdomen. To get a better look at the aorta, we'll remove the overlying pleura and part of the pericardium that surrounds the heart. We'll also remove the body of the sternum and the lower half of the manubrium. The part of the aorta that lies within the thorax is called the thoracic aorta. It's spoken of as having 3 parts: the ascending aorta, the arch, and the descending aorta. The aorta arises here from the left ventricle. To its left is the pulmonary trunk. To its right is the superior vena cava. The ascending aorta runs upwards with a slight curve to the left. It has no branches. The arch of the aorta makes a complete 180-degree turn. Beneath the arch of the aorta is the pulmonary trunk, dividing into the 2 pulmonary arteries. Here's the left one. This is the ligamentum arteriosum. Also beneath the arch are the left main bronchus and the left pulmonary veins. To the right of the arch is the lower end of the trachea. Before we move on to the descending aorta, we'll take a look at the 3 major arteries which arise from the arch. These are the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. The brachiocephalic trunk, also known as the innominate artery, divides to form the right subclavian and the right common carotid arteries. Here are the origins of these three arteries: brachiocephalic, left common carotid, left subclavian. Here they are, emerging through the upper thoracic aperture. To see them clearly, we'll remove these veins, the right and left brachiocephalic veins, which unite to form the superior vena cava. We'll also remove the rest of the manubrium and the two first ribs from here to here. The brachiocephalic artery divides here into the right subclavian and the right common carotid arteries. Here's the left common carotid. Here's the left subclavian. The subclavian and common carotid arteries are shown in volumes 1 and 4 respectively. In this section, we'll look at one branch of the subclavian that's important in the thorax, the internal thoracic artery. To look at it, we'll put the first rib and the manubrium back in place. The subclavian artery arches over the upper surface of the first rib, passing behind the anterior scalene muscle. Before passing behind the anterior scalene, it gives up these branches: the thyrocervical, the vertebral, and this one, the internal thoracic. Internal thoracic artery runs downward and forward over the dome of the pleura and passes behind the first costal cartilage. To see where it goes, we'll look at a dissection of the anterior chest wall by itself, seen from behind. Here are the two internal thoracic arteries. After passing behind the first rib, which is here, each one runs down the inside of the chest wall, just lateral to the sternum, in front of the transversus thoracis muscle. Its branches supply the anterior chest wall. Its distal continuation, known as the superior epigastric artery, supplies the upper part of the anterior abdominal wall, as we'll see in the next section. Now we'll return to the aorta. We've seen the arch. Now we'll look at the descending aorta. To get a clear look at it, we'll take the heart and the arch of the aorta out of the picture. The descending aorta runs downwards in close company with the esophagus. The esophagus lies medial to it up here, in front of it down here. We'll remove the esophagus. On each side, the descending aorta gives up this series of posterior intercostal arteries, one for each of the intercostal spaces except the first two. Each posterior intercostal artery passes along the deep aspect of an internal intercostal muscle, in company with an intercostal vein and nerve. It stays close to the lower border of the rib, in this groove that we saw earlier.